Professor Abayomi, many thanks for speaking to us today. Having less accurate knowledge about COVID-19 is said to be associated with a greater likelihood of catching the virus. Let's start off by speaking about vaccinations. Since March 2021, I believe that Nigeria has received about 33 million doses of the COVID-19 vaccine. Now, of this number, only 4.7 million people countrywide are fully vaccinated. What percentage of the population in Lagos State is currently fully vaccinated, and what are the state's vaccination targets?
So right now we've reached our own target of about 3.4 of the eligible Lagos population. Mr. Governor set a target for 30% at the end of 2021 and 60% by the middle of 2022. So you can see we're way behind target, but there are a number of reasons for that. So first of all, Lagos has always been the epicenter. And so when we first got access to vaccines, there was a mad rush for vaccines. And I believe that most people who wanted to and needed to be vaccinated got vaccinated in the first, second, and third phase of our vaccine strategy or campaign. And those are essentially people that wanted to travel, people that were involved in corporate activity, our frontline workers. And so subsequently, the demand for vaccines amongst the population subsided. Despite watching international television and seeing multiple devastating waves around the world, we in Lagos seem to have managed our 4 waves quite well. And so I think that the general public have other priorities. They know COVID is there. I think anybody in Lagos now that says there's no COVID can't be living in Lagos. But they don't see the major impact. They can see that, over time people get admitted, a lot of people get sick, but they get discharged, very few people die. And so they're thinking, okay, I just need to get on with my life in Lagos, and, if I get sick, I'll get better. So what we need to do in Lagos now to hit those targets is we need a vaccine strategy, which Mr. Governor is designing at the moment together with our technical team here, to see how we can compel Lagosians, not in an autocratic way, but incentivize them, and then slowly tighten the reasons why you need to have a vaccine so that we can ramp up those numbers.
Now, the Omicron variant, when first discovered, was a cause for alarm because of how quickly it spreads. But this variant is proving to be a milder version of COVID-19. There are questions as to whether Omicron could provide the mass immunity that we're looking for globally. What are your thoughts on this?
So the original terminology of herd immunity, if you go back centuries, and it came from the animal kingdom. So when a virus infected a herd of cattle or a herd of zebras or antelopes, it would infect them, kill some, but those that survived were resistant to the virus. And so the virus would naturally peter out, and that herd would continue to survive. But with modern technology, we're able to do both. Natural infection herd immunity and vaccine-induced herd immunity. And when you combine the two, you have a more robust level of defense against the virus. The only problem is that this herd immunity that we are developing as human beings against COVID doesn't seem to last long. Whether it's the natural infection or it's the vaccine-induced immunity, and when you have both working together, so you've had the natural infection and then you have the vaccine, you get a real high spike in your immune system, but that spike goes up and comes down very quickly. The science is telling us that it probably lasts between 4 and 8 weeks. That means that immediately after you've had COVID, or immediately after you've had the vaccine, or immediately after you've had both COVID and the vaccine, you're protected for about 3 months. After that, you're losing your protection, especially if the virus is changing its genetic code. So your immunity won't recognize the new variants that are emerging.
There have been rumors about people who are getting eligible and authentic vaccine cards without actually taking the vaccine. Now, this may be people who may want to travel, but they don't necessarily want to take the jabs. First of all, what do you have to say about this? And then at the same time, what are the penalties that are involved here for people who may be found complicit, both within the Ministry of Health and also, of course, those who are getting these vaccine cards without taking the jabs?
So we've discovered, and it's not news to Lagosians and Nigerians, that there are all kinds of sharp practices going on around COVID management. If it's not testing, it's vaccines, vaccine certificates, and all kinds of things happening. Lagos has adopted a zero tolerance towards these kinds of sharp practices because our data is very strong. And it shows a very, very strong correlation between these acts of civil disobedience and our 4 waves. And it spans across the whole testing story, vaccination story, and compliance to isolation. So we've set up, through the laws that we've promulgated in Lagos, we've set up our mobile courts. And we know who's coming in, we know who's defaulted, we know where there are opportunities for you to get fake COVID tests or COVID vaccination cards. So we're performing sting operations all the time. We're calling thousands of people. If you don't do your day 2 test or your day 7 test, then you get a call. And I think most Lagosians now know that if you don't do what the government says, you're going to get a call. And that call, if you can't prove that you've been compliant with the guidelines or you've been parading a fake certificate or a vaccine, that you're going to get pulled before a mobile court. And you're going to have to explain why you didn't do your test or why you have a fake vaccine card or a fake test, and you'll be sanctioned. You want to travel for business or vacation or whatever your ticket is, hundreds of thousands of naira or millions of naira, well, go and get yourself tested. And you're on your way back, test yourself again at your expense. It's not part of the public health response. There's still a significant cost involved in managing COVID, but the government subsidizes and gives PCR testing to Lagosians in the public sector free. If you want to access the test in the private sector because you want to travel, then you pay that fee. But Mr. Governor has asked us to revise and to look at the cost of testing, and we have done that very carefully, despite the fact that the reagents are going up and down because of the mutations of the virus. So it's not coming down as fast as we wanted to. In fact, sometimes it's going up, but we're looking for faster and more efficient ways of doing these tests within the consortium. And we're just about going to announce a reduction in the price of the PCR tests, even for those people who want to travel.
Is the spike that we've seen over the past few weeks due to new variants, or are there other factors at play here that we're not paying enough attention to?
So we've done our sequence analysis and we've given that result to the Presidential Steering Committee. And our data shows that the predominant virus in circulation in Lagos now is Omicron. And it's very clear from our data, and it's also clear from the clinical picture of what we're seeing. The ability of this new variant to spread very quickly is what we're seeing in other parts of the world. It's not really going for the respiratory system. So the pattern is consistent. So our genetic sequencing is matching what we're seeing in the clinical arena. And the fourth wave, as we predicted, was going to have a very sharp uprise and a very sharp downstroke. And that's exactly what happened. So Omicron went through Lagos like a wildfire. And I think everybody recognizes that. At one point around Christmas and the New Year, there wasn't a household that didn't have somebody with a respiratory tract infection feeling awful, but not in respiratory failure.
It's been over 2 years now since COVID-19 was first detected. Is it believed that this virus is now endemic? Is it here to stay?
So I think just like the flu, human science and human biotechnology is advancing at an incredible pace. And, 10 or 20 years, we wouldn't have been able to manage COVID the way we're managing COVID now, in terms of the science around testing, the science around sequencing, the science around vaccine development, the science around new drug development. There are a lot of vaccines available. There are quite a number of drugs that we believe are quite effective against COVID now. In fact, Lagos has a stockpile of these drugs, just in case we have a surge of patients that require hospitalization and require drug treatments. So Mr. Governor has approved that we have a reasonable stockpile of some of these very new innovative drugs in Lagos in case people are getting sick, and so we can intervene both with hospital management and with these new drugs. So I believe that science is getting on top of COVID. We don't want collateral damage, which means that we're spending all our time and our resources managing COVID and neglecting a myriad of other medical conditions in Lagos. And we've succeeded at doing that in Lagos. We've not allowed COVID to interfere with the management of the rest of medical conditions. And that's a big credit to Mr. Governor and his cabinet and the incident command system, that we've been able to isolate COVID, manage COVID, and maintain the management of other conditions around Lagos and make sure that only few facilities are concerned with the management of COVID, and the other 27 and 300 primary health, 27 general hospitals and 300 prime PHCs and tertiary facilities are busy doing what they normally do. The key is that we've been able to keep the economy open despite a pandemic.
Professor Abayomi, Lagos State Commissioner for Health, many thanks for speaking to us today on Arise News.